So the invisible braces, like the aligners, the advantage, the main advantage, is that they are invisible. They are, a lot more subtle, and sometimes they are indetectable when patients are wearing them. So that's the main advantage. Of course, they don't move teeth quite as well as the, for example, the fixed ceramic braces. And they do a very different job to the orthopedic braces, whereas the invisible braces are moving the teeth themselves. The orthopedic braces are actually developing the jaws. So the optimal age to get braces is depending what stage of treatment we're trying to carry out, but anything from around 8 or 9 years old for the early intervention treatment, to then the 12, 13-year-olds, where most patients are ready for the fixed tracks. They've got all their adult teeth in, so we can actually start to straighten the teeth. To any age up to about 80 years old, because we can move teeth around really at any age. And it makes no difference how old you are, how quickly the teeth move. It varies what kind of treatment that we are carrying out on the patients. So some of the early interventional treatment can be around 6 months, and some of the more traditional, the fixed train track type of approach is about 18 to 24 months of treatment. And of course, with the aligner, the kind of invisible brace kind of approach, that can start anywhere from about a 4-month very simple treatment to about 12 months treatment for that type of approach. And of course, moving the teeth into the perfect positions is only the beginning. Yes, we need to make sure the results stay. So we have we emphasize the use of retainers being very important, and that will give the results lasting for life if our patients follow the retainer protocol, which is to wear a plastic retainer, usually just at night, and eventually just one night a month is all that it takes to keep those teeth from moving. And we also, on top of that, often have a fixed retainer, which is a wire which goes behind the teeth, usually just the front 4 to 6 teeth, but they go behind, no one can see it, and that invisibly stops the teeth from moving after treatment. Yes, overbites are probably one of the main reasons why patients seek treatment. They have these prominent upper teeth, and often when I am assessing a patient, one of the main things I look at when there's an overbite is, is it the top teeth? Are they too far forward in the mouth, in the face? Do we want to bring those back? And yes, that's very easily achieved with a either an aligner or a fixed brace to really bring those back and bring them into a good position and really get rid of that overbite. But when I see kids early, more often than not, the overbite is actually a combination of maybe the upper teeth are forward, but the lower teeth and the lower jaw is a little bit back. And that's again where the early interventional treatment to develop the lower jaw, use an orthopedic brace to bring the lower jaw and the lower teeth back. And then again, that gets rid of our overbite and gives a much better, more pleasing cosmetic result. And gaps in teeth, I mean, that's we like gaps. Gaps are much easier to fix than overcrowding, which is the opposite to gaps. So again, that's a very, very simple treatment, often using fixed braces. We can very easily close gaps once we've got something fixed to the teeth, and we literally put an elastic chain that closes those gaps. And then as long as patients wear our retainers, or sometimes we put a fixed retainer behind the teeth to hold those spaces closed, those gaps should not come back.